Welcome all to the Data, Rigor, and Reproducibility in Light of Diversity, Equity, and Inclusion Symposium. My name is Shanda Hunt. I am the Public Health Librarian and Data Curation Specialist here at the University of Minnesota. It's really wonderful to see some of you in person here in the audience. For some of us, this might be the first big event that we've attended in person in maybe 2 years. And we are equally honored to be joined by our online attendees who are maybe joining their 300th Zoom meeting or 600th or 900th. So no matter how you're joining us today, we encourage you to be well and care for yourself as needed. So we're going to go over a couple of logistics as we get started today. If you are with us online, you should turn your camera on or off as you see fit throughout the program today. You can pose questions in the Q&A and a moderator will communicate those to our speakers, or during the Q&A time, feel free to unmute your microphone and ask a question. In-person attendees will find male and female restrooms on this floor of the building, and an all-gender restroom is on the second floor of the building. If there are any barriers to your inclusion in today's activities, please reach out to us. I want to share what you can expect in terms of the schedule today. We have 4 speakers who will present for 35 minutes each, followed by 10 minutes of Q&A after each presenter. We'll take a coffee break at 10:45, lunch break at noon, and another coffee break at 2 o'clock. And this afternoon, we will welcome 4 lightning talks presented virtually, followed by a panel of our morning speakers, moderated by Professor Alan Love. We will close the day with a reception at 4 p.m. in the Campus Club, which is on the 4th floor of this building. You can access the day's schedule on the website reproducibility.umn.edu/symposia. Our event today is a product of the Many Faces of Reproducibility initiative, a 3-year project supported by the College of Liberal Arts at the University of Minnesota, involving an interdisciplinary exploration of different facets of reproducibility across the social, behavioral, and natural sciences. It aims to advance scholarship on reproducibility, develop innovative approaches for training researchers, and engage the public regarding the trustworthiness of scientific claims. We gratefully acknowledge the College of Liberal Arts for funding this event. You have 3 hosts today: Alan Love, professor in the Department of Philosophy and director of the Minnesota Center for Philosophy of Science, Amy Riggleman, social sciences librarian, and myself. We came together through the Many Faces of Reproducibility initiative and the creation of a library guide that Amy and I co-authored called Conducting Research Through an Anti-Racism Lens. Our shared interests inspired us to collaborate to plan today's symposium, which was made possible with the crucial help of Janet McKernan. We are not the experts, but hope to draw attention to work being done and stimulate more conversations about what we can do in the future. At this time, I want to acknowledge the land that we are on today. The University of Minnesota illegally occupies the traditional, ancestral, and contemporary lands of the Dakota and Anishinaabe peoples in violation of the 1805, 1837, and 1851 treaties with the Dakota Nation. Learn more about this by reading Where We Stand, the University of Minnesota and Dakota Treaty Lands by Shanta Maza, also known as Neil McKay, and Monica Seams McKay. Historically, the University of Minnesota has not worked alongside or advocated for Minnesota Indigenous people or nations. However, very recently, Professor Tad Johnson and Karen Diver accepted important positions at the university. Professor Tad Johnson, an enrolled member of the Boys Fort Band of Chippewa, is the first senior director of American Indian Tribal Nations Relations. In this role, he serves as the liaison between the entire University of Minnesota system and the regional tribal nations. Karen Diver, member of the Fond du Lac Band of Lake Superior, Chippewa, is the first senior advisor to the president for Native American Affairs. In this role, she builds trust with the tribes and helps Indigenous students succeed through efforts such as critical examination of whether U of M curriculum appeals to Native students. Please continue to follow and support the efforts of Professor Tad Johnson and Karen Diver. We must hold each other accountable, ensuring that our institution provides support, resources, and programs that increase access to all aspects of higher education for Indigenous students, staff, faculty, and community members. I will now introduce Amy Riggleman, who will announce our spectacular speakers and set the context for the conversation today.
Good morning. I'm Amy Riggleman, and I am a social sciences librarian and co-chair of an our evidence synthesis service in the University of Minnesota Libraries. One of my research interests has been examining ways in which libraries can best support replicability and reproducibility, whether it be through data sharing, data curation, which is one of the things Shanda mentioned, reproducible search methodology, and even how to identify if articles have been retracted. In the aforementioned Many Faces of Reproducibility initiative funded by College of Liberal Arts, many of us on campus have had an opportunity to work together on reproducibility and replicability topics and come together, like today, to learn from experts in events like this symposium. One of the reasons why this symposium came to be was a guide that Shanda and I created, conducting research through an anti-racism lens. Librarians supporting various disciplines across campus were approached by faculty in the last several years, but especially after the murder of George Floyd in 2020. And these faculty were seeking assistance in being more inclusive in their research practices. And since they were reaching out to us, this was usually in the context of wanting to consume and cite research and then be more representative of different populations. Many wanted to diversify their syllabi or the literature reviews in their primary research articles. And this prompted us to create this guide to share ways to decenter whiteness in primary and secondary research, and additionally acknowledge that the scholarly publishing ecosystem, search algorithms, and even library cataloging systems are currently or historically racist. In curating this guide, we point to concerns about white as the default in many aspects of the research lifecycle, which could be detrimental to populations that were not included in those research samples. Additionally, if researchers claim that their findings are generalizable across populations, evidence should be made available demonstrating this in the spirit of extraordinary claims require extraordinary evidence. This leads us to this symposium, which ideally will be a catalyst for improved research practices. Today, we'll explore innovative approaches to bettering inclusivity in research, bring a wider audience into the research conversation, and learn from a range of disciplinary perspectives. Today, the experts we are learning from have expertise encompassing several disciplines, or their work is naturally interdisciplinary. First, we will be learning from Sharon Zanti from the School of Social Policy and Practice at the University of Pennsylvania, and Ben Jaques-Leslie, a research scientist from the Minnesota Department of Human Services. They'll be talking about integrating and prioritizing racial equity throughout the data lifecycle. Genevieve Wojcik is joining us today from the Department of Epidemiology at Johns Hopkins. She will be talking about the lack of representation in study populations, since genomic research often includes a majority of European ancestry. She'll talk about reporting guidelines as a potential way in which scholars can be held accountable. Psychology professor Moin Syed from University of Minnesota will be speaking about reproducibility and an inference crisis, where scholars struggle to make sense of group variation in psychology research with respect to race and ethnicity. This afternoon, we'll be learning from Eleo Tripp, a presidential postdoctoral fellow in speech, language, and hearing sciences here at the University of Minnesota, who will be talking about their work modeling linguistic diversity and addressing what is noise and what is or isn't variation. This will be followed by lightning talks and a panel discussion, as Shanda mentioned, racial equity throughout the data lifecycle.
Hello to everyone who's here in the room with us today and to everyone in our online Zoom room. I am very grateful to be here today speaking with you and very excited to keep learning alongside everyone here. Because when it comes to these topics, to data, rigor, reproducibility, diversity, equity, and inclusion, we are all learning. There's no arrival point at which we will become masters of any of these topics. And it's really a continual cycle of growth, failure, and adapting. My name is Sharon, and I am a doctoral student at the University of Pennsylvania, and I work with an organization called Actionable Intelligence for Social Policy, or AISP. We're based out of the School of Social Policy and Practice. And what we do at AISP is help state and local human service agencies collaborate and figure out how to responsibly use their data. I'm here today to talk about work I've been a part of with my colleagues at AISP. We developed a toolkit for centering racial equity across the data lifecycle. We'll talk more about what that means in just a minute, how we developed this toolkit, and what you might be able to learn from it. But first, I want to acknowledge that my colleague, Amy Hahn-Nelson, is really the one who spearheaded this work, and I just happen to be lucky enough to get to talk to you about it today. I am also very lucky to be joined today by Ben Jaques-Leslie from the Minnesota Department of Human Services. At the end of this session, Ben is going to talk to us about some real life examples of how the state of Minnesota is centering racial equity throughout the data lifecycle. And I'll have Ben tell you more about that when we get there. So again, at AISP, we help state and local government agencies, some universities and some nonprofits too, use their data to improve their policies and programs. Our philosophy is that using data, sharing it, integrating it, and analyzing it is just as much, maybe if not more so, about relationships rather than about the technical aspects of joining and analyzing data sets. So we don't just need to integrate data to make better policies and services. We need to integrate the people who are represented in the data and the people who are using the data to make decisions. Now, I want to go back to the title of this presentation, Centering Racial Equity Across the Data Lifecycle. What do you think centering racial equity means, that first part of this title? So go ahead and take a minute, think about it. You're welcome to shout something out, type something in the Zoom chat. There are many right answers here. So there are multiple ways we can define racial equity and many reasons that we should be thinking about it in whatever our line of work is. Broadly, what I'll reiterate is that when we talk about centering racial equity, we're talking about getting to a point where race doesn't have an inherent advantage or disadvantage in outcomes. So for example, at AISP, we work with a lot of agencies that oversee child welfare programs. And we know that generally Black children are overrepresented in child welfare cases. This is not racial equity. If there were racial equity in child welfare, we would see similar rates of representation across races. Now, moving on to the second part of today's title, what do you think across the data life cycle means? And just give you a moment to think about that, across the data life cycle. So here is one version of a data life cycle. It's the process that data go through. It often starts with planning, what type of data you'll use, what types of projects you'll take on. figuring out how to collect the data, who has access to the data and how you might grant them access, using statistical tools and algorithms to analyze the data, and then reporting out what you find. So I'd like everyone to take a moment and visualize what parts of the data lifecycle you might touch in your work. Maybe it's just one phase that you really focus on. Maybe it's a few, or maybe you happen to touch all of these in the different roles that you play. So with that in mind, at what stages of the data lifecycle do you think we need to center racial equity? And you might have guessed it, but the answer is everywhere. No matter where you plug into this life cycle, there is a role for you in centering racial equity. And in a few minutes, we'll get to talking about some more concrete ideas for that and getting started on this work of centering racial equity across the data life cycle. Now, before we keep moving, I also want to acknowledge that our identity matters when we talk about centering racial equity. So what identities do you bring to this discussion? And how do they impact your comfort level with talking about this unique intersection of fields? On the one hand, we've got data integration, data infrastructure building, and then on the other, we're talking about race, racism, structural racism. This diversity wheel tool has been around for a while, but I still find it very helpful for thinking about the different dimensions that I'm bringing when I show up to work or to a new project. And I'd encourage you to come back to this or to some similar tool that works for you when you start a new project and reflect on what resonates with you, what parts of your identity may impact the work that you are doing. And why are we focused so much on identity with this topic? Well, in order to dismantle harmful practices and uses of data at the macro level, like in policymaking, we have to simultaneously be working to dismantle our own biases at the micro level and the norms and culture and biases that exist at the community or meso level. Obviously, an important identity to acknowledge within this discussion is race. I'm white, as you probably guessed already. And if you saw my Instagram, you would say, yep, that's definitely a white lady up there. So the organization I work for and the university I'm a part of are also majority white. The question is, what is the role of whiteness in working for racial equity and racial justice? Should we have a role? There are many answers to this, and like any complex question, no perfect answer. Malcolm X famously said that there isn't a role for white people in this work for racial justice. Some people would argue that white people should have a role because we have largely been responsible for creating the systems and structures that uphold racial inequity. And we might have some power and positionality to do something about that. So where we've landed at AISP is that since our focus is on the ethical use of data in public sector, we can't really sidestep the role of racial equity and our own race in this work. We are uniquely poised to support this unique intersection of fields, again, thinking about data and data infrastructure and racial equity. In the US especially, you can't have responsible ethical data use that ignores the role of racism and its history. But we have to walk this world carefully and interrogate our biases and blind spots along the way and be open to changing. We are committed to this very messy work, to what our colleague and one of our great toolkit collaborators, Tawana Petty, would call the work to coliberation. Now, we've been talking around it a lot, but what is this toolkit exactly? And why did we make it and where did it come from? Well, in 2017, we had several of our network members at AISP. Again, those are mainly state, local human service agencies who are trying to build their data capacity. And they said they needed help addressing issues of bias within their data and thinking about how equity and race intersects with their work. We looked around for best practices in this area and we came up short. We found that this unique intersection of spaces between data infrastructure, and race equity was pretty vacant. We looked for examples of exemplars in this field, and we found that the people doing the best examples of this work were not willing to even call themselves exemplars. So we realized that our people needed more guidance, and we needed help putting together that guidance. So we sought funding, and in 2018, Amy Hahn Nelson started putting together a work group. In 2019, that work group met over several meetings and pulled together their collective knowledge that informed the toolkit. And you can see in 2020 is when we formally published the toolkit and put it out into the world. We're now in the process of disseminating it, gathering insights for that version 2.0, because again, this is continual learning. The toolkit isn't an arrival point that has all the right answers. It's a starting place where we're building from. So to speak a little bit more about how this toolkit was generated, we started by curating a work group of 15 members from a diversity of backgrounds, not just in terms of their race and ethnicity, but also in terms of their perspectives coming into this topic, where their comfort level was in talking about these two issues of data and race. They also came from a variety of geographic locations in the US, different types of municipalities with different political structures. The work group met over a series of months to create the framework that is laid out in the toolkit. We use two key methods here, public deliberation and community participatory action research, to generate the toolkit content. And for anyone who's curious to talk more about that, I'm happy to take questions, talk more about it later. And we also have an academic publication that goes more in detail about the methods, and that's in an open access journal where anyone can look at it. We also want to acknowledge that the work we're talking about today was very much a collaborative effort. Here are the workgroup members who contributed to this toolkit. And here are our site-based contributors. These are agencies and organizations who are doing the work on the ground and who we lift up in the toolkit as examples of centering racial equity throughout different stages of the data lifecycle. These folks guided a lot of our writing and helped us frame out the lessons learned. So that's our quick overview of what this toolkit is, how it came to be, but I want to bring it back to that big picture we sort of started with. Where we are right now is complicated. Governments, universities, and most organizations have more data than they've ever had before. But they don't necessarily know what to do with it, how to access it or use it and analyze it ethically. Public agencies especially, and for very good reason, are often hesitant to use data because we know that administrative data is inherently biased, it can be problematic, and it also contains highly sensitive data like people's health details and interactions with systems like child welfare and public benefits. Administrative data sets have some clear pitfalls too. They don't reflect lived experience. They're not usually historically contextualized. It can be hard to distinguish correlation versus causation within these data. And we can't always measure the outcomes we really want to know about. We may have proxies that we think are a good estimate of an outcome, but administrative data don't always include what we're really trying to measure. Data are a powerful public good, but they often reflect legacies of racist policies that have produced inequities in resource allocation, access, and outcomes. We'd like to think of this work as similar to the construction of highways and railroads. As railroads in the 1800s, highways in the 1900s, both decimated and developed communities, so too can data infrastructure. We can co-create the data infrastructure right now to be informed by a race equity lens, to think about bias and potential harms. We can invest in this type of data infrastructure, or we can continue on the path that many agencies are on, which is to disregard historical context, to disregard the bias baked into data, and to go forth as is without critically examining systems and how they produce the data that they have. We know from the history of highways and railroads that not thinking about the intended and unintended consequences, we inadvertently decimated certain communities, and those are most often communities of color. We want to remember this as we move forward with any type of data work. So how do we do this? Now getting on to some of the concrete practical stuff. Let's go back to our data lifecycle. Remember, we want to think about centering racial equity across the data lifecycle. Our toolkit is organized by this lifecycle. So if you pull it up at some point, you'll see there's a section for each of these phases. And in each phase, we discuss positive and problematic practices for centering racial equity and examples of real life work in action, which Ben is going to give us a few in just a few moments. So let's talk about some of the concrete ways that we can center racial equity. We're going to touch on two phases here today, And if you want more, we can definitely keep talking later, and you can find more in the toolkit. Planning, the first stage, is incredibly important, and it's a phase I'm going to guess most of you have to touch at some point. Whether you're a student planning how you're going to use data for a project, or a faculty member figuring out what data you need to answer your next big research question, or a community member who is weighing in on a project that will impact you. When you're deciding what to do with data, what type of projects you might take on, what type of goals you have, a great place to start is by incorporating the voice of community members, like families who receive services or others who have lived experience in any type of planning committee, task force that you can. You can also put time into researching and understanding the history of relevant policies, institutions, and systems, and using that information to inform future efforts and to educate others. On the problematic side, we'd caution you to always think about the authenticity of any community engagement that you do, and to avoid token representation. So that means like not looking to one person, assuming that they can represent the voice of an entire community. And making sure that community members who you are engaging in this process have the power to actually influence decisions, that it's not just a ceremonial seat, that they have voting power, that they have the ability to help shape what happens with a policy or program. And in that process, it's important to be clear about what is in the potential realm of change so that people know what they can influence. We also think it's important to not solely rely on academic institutions to frame what the problem is you're trying to solve, why it's important, and what the research questions should be. You can look to community organizations and advocates, community voice councils, and other stakeholders who are a little bit closer to the issue on the ground to help with this planning work. On this slide, we have our benefit risk matrix that is a really great activity to do at the planning phase of any project, where you basically build your own matrix for your community or jurisdiction or whatever your group is to help determine what projects or analyses you might want to take on. The matrix here represents one example from one community about how risky and how beneficial different analysis projects are. The farther you go right, the higher the risk, and the higher you go up vertically, the higher the perceived benefit. So for example, on the bottom right, we have linking biometric data, like using facial recognition, which we all probably use day to day on our phones and other devices. This is a highly risky use of data, especially for human service systems, because it is very sensitive. We know that there are inaccuracies in these data, particularly for people of color. Facial recognition software does not work as well across races. This community also rated this use of data as pretty low benefit to them at this time. And you can see that everything else in this red box over here are projects that are risky and also not a super high benefit to this community. So they're probably not the best place to start. And on the opposite end in the green box are projects that have a lower risk for this community and a really high potential benefit. Things like mapping indicators to figure out where to allocate new resources, program evaluations, deduplicating records, which can help improve future analyses. And again, risk and benefit are going to differ depending on where you are, what data are available, the quality of those data, who's being served, and what the history is there. But this is a great activity to map out potential projects and prioritize them, and a great place to pull in any community representatives that you have. So the other phase I'll talk about for a few minutes is analysis, since again, this is quite a common phase that most of us who do any data project will have to cross at some point. Here are a few examples from the analysis phase of the data lifecycle of positive and problematic practices. Again, we have many additional examples in our toolkit if you want to learn more. So we tend to really emphasize mixed methods approaches because as much as we love the power of administrative data for answering research and policy questions, these data, again, they lack contextual experience and they can often overshadow unique differences and experiences for certain populations of people. So if you have the opportunity to also engage in qualitative data collection and evaluation, that can help contextualize any quantitative findings that you have. Disaggregating data in the analysis phase can also help with understanding intersectional experiences or how certain neighborhoods or racial groups or other identities are experiencing an issue. I'll use the pandemic as an example. It's not enough to just look at cases, hospitalizations, and deaths in the aggregate to judge how a particular municipality is doing with containing the spread of COVID-19. We need to see how these stats compare across neighborhoods and other important spatial subdivisions within a jurisdiction. These types of analyses have shown us that Black and Brown communities have been disproportionately impacted by COVID-19, and that we need different strategies and resources to mitigate this. Now, on the problematic side, we want to make sure not to describe outcomes without examining larger systems and policies that contribute to disparities. And any data we analyze should have the intent to drive real change that can actually benefit communities. So continuing with this COVID-19 example, it's not enough to just stop at Black and Brown communities are being hit harder. What are we going to do about it? And how are we going to use the data we have to work towards equity, to improve lives? As part of this, we also need to examine how larger structures like poverty, housing, access to healthcare, and resources can influence who is having what type of experience with the pandemic. And lastly, I'll highlight that especially when dealing with complex issues like the pandemic or other social problems, one-dimensional data are not enough. We've talked about disaggregating data, looking at historical context, bringing in qualitative accounts. There are multiple ways of knowing and of describing an issue. Bring all of that into your analyses and your projects. I always have a red flag go up when I hear one data point being used to propel a big agenda item. The issues we're talking about in human service and more broadly are socially complex. We need multiple viewpoints, sources of data, and critical engagement to think through the messiness and to engage in a rigorous approach. Before I turn it over to Ben to give us some examples of how Minnesota Department of Human Services is putting some of these practices into action, I want to emphasize what I hope you will take home today if you take home one thing, which is no matter your role or which stages of the data lifecycle you touch, there is something that you can start doing today to center racial equity. And I'm happy to talk more about this with anyone. So I'm going to invite Ben up now to talk about his work in Minnesota, and I'll leave you with these questions to just noodle on. We can come back to them during Q&A, the panel, or even over email later. But I think it's important to acknowledge that this work of centering racial equity across the data lifecycle is not easy. There are sticky issues and ideas that come up, and we have to break it down into manageable chunks and actions that we can take to move forward. So with that, I'll have Ben come up.
Hello, everyone here and elsewhere in the world. My name is Ben Jaques-Leslie, and I work at the Department of Human Services. So in the presentation, you can see the org chart of the Department of Human Services, and I'm not going to quiz you on this. It's just to give you an example of how big and broad the Department of Human Services is in Minnesota. We do everything from direct care to housing support to healthcare. We've done tons and tons of things. I work in the black box in Children and Family Services within a division that does economic assistance and employment supports, which is cash support, which some people might call welfare. In Minnesota, we call it MFIP, or the Minnesota Family Investment Program, and food support, otherwise known as SNAP. So what I'm going to talk about is just sort of our small world of the Department of Human Services. That a lot of different stuff happens across the agency that I don't know about. So just keep that in mind. I'm going to try to pull on a bunch of different threads of this symposium and reflect on what Sharon talked about before. So first, I wanted to talk a little bit about our data and how we sort of elements that we use to examine equity. So most of our data comes from our eligibility systems. So when a person comes to a local agency, which would be a county or a tribal government, to get cash or food support, they'll sit down with a worker and provide various pieces of information to determine their eligibility for different programs. And that system is called Maxis. And it's from that system that we get most of our data that we use. This is the administrative data that Sharon was talking about before. In that data, we have some information about race and ethnicity. We have information about gender, about age, about disabilities, about household composition. I'll note the system is old. I think it's a black screen with green type that you have to enter codes in. You can't there's no mouse. It's really amazing. And so the actual pieces of data you have are definitely not what you would want to see based on our perspective of data in 2021. But it has a lot of useful pieces of information about folks. So with this in mind, I want to give you the first example. So there's a program ongoing called Emergency SNAP. SNAP, again, is food support. It's a pandemic program. And what it does is it provides the maximum amount of food support to families based on household size, regardless of their income. Generally, what happens with food support is that the amount of food support you get is reduced by how much income you have. So if you're a household of 3 and you have some earnings or unearned income, you maybe get $100 a month in food support. Well, during Emergency SNAP, you get $650 worth of food support. I did all the data work to set up this program when it was first starting at the beginning of the pandemic to calculate all of the families in Minnesota's extra bit of SNAP. And so understanding the kind of what the population that is served by SNAP, I was very curious about at a population level, how equitable was the distribution of this new benefit across our population. And so the very first thing I got to was this picture. So this picture is the increase due to Emergency SNAP for families divided by white-headed households and BIPOC households. And you can see in the upper right that the average increase per person is much less for BIPOC families than it is for white families. Now, understanding the population a bit more, so SNAP cases, you can have a single person case, and based on the schedule that sort of determines benefits, that means that their increase might be greater. And many single person cases are seniors or people with disabilities. And they are vast majority are white in Minnesota. So I dug and dug. But regardless of age, disability, household size, earnings, unearned income, this disparity on the per person increase due to Emergency SNAP persists between BIPOC and white-headed households. So I'm just providing you this example of how we've used this data to understand some outputs from our programs, how it might be happening, and just try to elevate this information to leadership. The second theme of this symposium that I wanted to pull on was reproducibility. So reproducibility for us in government, I think, is very different than academia. We aren't going to make our data public for y'all to reproduce our analyses. It's very private data. We're still at that stage 1 of trying to make sure we in our own departments can get the same results from each other. Our database is very, very complicated. It's easy to get different results. So that's our sort of first focus. What I tend to do, and I think what our team likes to do, is use code-based data extraction and analysis to increase the ability of reproducibility over GUI, graphical user interface type analysis tools like Tableau. I'm a SQL and R user personally, and I think this has really helped our reproducibility. Last thing I like to do a lot is I create a lot of, in my coding, I do a lot of local parameters so that my overall coding structure can be the same, whereas I can change a key parameter like the month I'm interested in, like the program I'm interested in, that sort of stuff. So an example of reproducibility is this performance measure we have of our cash assistance program of MFIP called the SelfSupport Index. This is reproducible for me because I have to do it every quarter, and I've done it every quarter for the past 5 years. So what it is, so something to understand about how our cash assistance program works in Minnesota, which is common across the country, is that it is state supervised and local agency administered. Again, local agencies are county and tribal governments. So the state supervises it, but the actual work of getting the funds to people and enrolling them comes at the local agency level. So we supervise them. So this performance measure tries to determine what the percent of successful adults are who were 3 years ago on MFIP. Successful means is a very specific definition in this measure, but it's easiest to say they're no longer on the program 3 years later. Now, we didn't want to have a target that was just sort of a consistent benchmark across the state, because we understood that there were different communities, different economies across the state. And this actually measure was created in collaboration with local agencies, with the University of Minnesota and other parties. So what we created is a regression adjusted target where we use information about individuals who are in cash assistance as well as local communities. And that's what their target is. But more importantly than that, there's another piece of this measure that actually helps to channel additional resources to agencies with participants who experience more constraints. And I'll just show you a quick picture of how that works. So this is a diagram of how the results from the self-support index are used. And again, I'm not going to quiz you on it, but the bottom right corner where it says annualized predicted score, difficulty factor consolidated funds portion, that little section shows where basically agencies that have lower predicted scores from this regression model get a slightly larger chunk of money to implement their programs. So it's like through this data, we make these predictions which come out of these correlations between success and different aspects of a person. If your agency has more people with constraints, you're going to get a little bit more money. The last theme that I wanted to pick up on was rigor, which honestly I was a little confused of what that meant. But that's me. So from my perspective, I think of rigor as like being able to show your work, basically. That's how I think of it. And so there's three things that I think, or show your work and make sure you're doing work well. So there's three things I wanted to talk about. First is whenever I do a data analysis or a data extraction, I always produce a report of what I did, which is actually not terribly common. And this has been super useful because when I provide data to somebody and they have a question about what I did, I can go back to the report and say, oh, I did this and that. And they can ask for a new version or their question is answered. And that is very, very useful. The second thing I do, which I'll talk a little bit more about, when we work on a collaborative program, collaborative analysis, we use pair programming, where one person is sort of the navigator who's describing the coding, and the other person is the driver who's actually kind of typing it in. And the last thing I try to do, which I'm not always great about, is I do version control using Git, where I'm taking notes about the edits that I've made. So an example of rigor comes from the TANF Data Collaborative, which is a program, it's actually how I met Sharon, which is a national initiative to help states use their cash assistance program data more effectively. I'm doing a lot of things in this, but the most exciting one is a collaboration with Dakota and Olmsted counties. So counties and local agencies generally don't have good access to the data on the programs they implement. So what I worked with them to create a kind of bespoke participant data set for each of the counties to analyze. And each week we sit together virtually and we code analysis together on this data set to look at a problem. So we've begun by looking at sanction rates. So when a participant in the cash assistance doesn't follow the rules, their case can be potentially sanctioned, which reduces their grant, sometimes by a really considerable amount. So we wanted to explore this. And I think what's really exciting about working with the local agencies who are doing implementation is that it allows us to investigate inequities in operations, which is a hard sort of space to get into from a state perspective when we're not actually implementing programs. So this picture shows the sanctions rates between these two agencies and also the NOITS rates. NOITS are the kind of letters that get sent out to participants to notify them that they might be sanctioned. And you can see this leads up to the pandemic. During the pandemic, sanctions were all waived. That's why it crashes to zero. But the takeaway here, I think, is that you see big differences between these two agencies, which is an important sort of just realization, because agencies are subject to the same rules, but you clearly see there's something different in the implementation happening, but it's hard for agencies to understand that the implementation might be different. So our next steps is to start looking at protected classes to see if there are differences in the implementation of sanctions and NOITs across the populations. So just to kind of pull on the equity takeaways from the examples I mentioned, the emergency SNAP, we get to look at this population level differences across different protected classes using our data that helps to inform how this policy might have been made better. The SelfSupport Index actually helps to channel some funding towards agencies that have participants who experience more constraints or barriers. And lastly, this TANF data collaborative has given us a really excellent opportunity to collaborate with local partners to examine bias in implementation, which has been very exciting. Thank you very much for your time. I guess if we have questions, shall Sharon come up? Thank you.
Okay, well, here is all of our contact info if you want to get in touch with us and talk after today, but I think we have a few minutes for questions. So I'll defer to the leaders here to let us know if there's anything coming in online, or I think in the room, there's a couple microphones available for questions too.
Always come in.
Hello. I have a question for both of you that maybe you could answer from your own perspectives about how, after one makes a decision at some aspect of the data and analysis lifecycle to make an intervention to better approach our goals for equity, how do we know whether or not the intervention worked? How do we measure it or decide whether or not something else needs to be done? This is, of course, mixed up with the complicated question of measuring causal effects. And so I imagine the answer is going to be very complicated. But since you're both thinking about this in a lot more detail than I have, I was hoping you could share your own perspectives on how that sort of thing could be measured.
Okay, great. Thanks. That's a wonderful question. And I think that is kind of like the million-dollar question after you've gone through the cycle and actually carry out a project. And a few things that I'll touch on that come to mind are that, we talked a little bit about rigor and multiple ways of knowing things. So you can bring those same principles into the next phase of evaluating how projects are doing. Part of that starts with what are the goals and the outcomes that you're hoping to see, and what do different stakeholders think of those? So the importance of bringing in community voice at the beginning is to understand, what are we actually trying to do? What does success look like? And like Ben, I used to work in a state Department of Human Services, and I can say that from the state's perspective, like what the governor thinks should happen with the program, or what the director thinks the goals are based on their own world, might be different at times from what participants in programs like TANF and food assistance and child welfare, those goals might be different. And so you want to start by having a strong foundation of what are we actually trying to achieve? And then from there, going through some of the tenets that we talked about today, and also other tenets from research of what are the best tools to answer the questions that we have and to measure certain things. So on the one hand, you might want to be using your administrative data to measure those program targets and objectives. Ben gave us a couple of great examples of ways that they measure success in their program. That might be something you want to keep doing to see, did our changes affect what's happening to people on the aggregate level? At the same time, you may also want to engage in qualitative research to understand, how are participants actually experiencing this change? Administrative data systems don't often capture like people's feelings about the program, or their satisfaction, or whether the child welfare services they received helped their family reunite in a way that was healthy for them. You can't really answer that with administrative data. but you can get at some of that by engaging people qualitatively on a deep level. So I think it's important to think about, again, what are you trying to do at the outset? And does that differ by stakeholder? And do you need to integrate multiple perspectives? And based on that, what is the right tool to measure it? Because it may not always be administrative data or causal analysis. It may be something more qualitative in nature.
Just a couple of things to add. So we also have at the state have a program called the two-generation policy program. Sorry. So I'm sure my colleagues are like cringing right now. But it was a kind of qualitative evaluation process, but it was mostly local sites testing out different initiatives that had a strong equity focus in their community. So I worked closely with White Earth Nation, but also we had partners in Northside Achievement Zone, St. Paul Promise Neighborhood, and down in Olmsted County. And so that was a really useful qualitative exercise. It got me thinking about ways we can bring more rigor to that. So I've been really interested in trying out like a process of Bayesian process tracing to like bring community and other stakeholders into the evaluation of information to set our how strong we feel the evidence is, how convincing it is in a kind of more formal structure. So that's something I've been thinking about a lot.
Okay, so this is a question maybe mostly for Ben, but I'm happy to hear Sharon's perspective as well. Ben, you raised the point about the sensitivity of the data that you work with, and that the ability to even achieve internal reproducibility is kind of primary, because it's not like you can just put it out there for other people to check your work. And this raises a question about the relationship between transparency and reproducibility. That is, the degree to which results can be sort of confirmed, given that some of the data in these circumstances cannot be used by more than a small subset of people who have relevant authorization. So I'm curious to hear you speak just briefly to how you think that affects trust for what is done in your agency and the kinds of analyses that you generate, given that, in a sense, outside agencies, in the sense of outside the government in particular, wouldn't come in and check the work, and yet you're also asking people to build policies and use the reports that you generate.
That's an awesome question. It's not an easy one. I'd say one thing that goes in the favor is that most of our analysis is pretty simple. It's like, here's a chart and the number of people, we're not doing, deep analyses that we're looking at causal inference too much of the time. So like, I don't think that the level of sort of analysis is as challenging as you might see out of, a quantitatively oriented paper that, one of your colleagues might publish. So I think of like the department, the state, we struggle with trust in the community at all levels, for rightly so, in many ways. So I think that the data piece is like a small piece of it. Hopefully that it can build trust if we're more transparent with what we're seeing. Internally, I also think that there's dynamics of trust. Sometimes people really want to hear outside voices. That's more convincing than inside voices. I also think internally you demonstrate good work over and over again. Internally, that helps build trust. Because there's also, there's a lot of heterogeneity in the skills of analysts across the department. So, there's just a whole range. There's people who have such deep knowledge about the program and the database. Then there's people like me who are like kind of new to that stuff, but like I have like a quantitative background. And so our skills that we can't check our work in the same avenue. They might check my work to say your policy interpretation here is crazy, but they maybe don't know what a regression is or something like that. So it's a big challenge. And I think it's, I think what Sharon is kind of talking about getting us to think about the life cycle and think about data in a deeper way, and that it's an investment that agencies need to make bigger. I think that's going to how we get to that level where we can even begin to get that kind of ability to check and get better transparency within an organization.
And I will just pop in with one thought on this. Again, this is such a great question and really crucial to the work that we do. At aisp, again, that's actionable intelligence for social policy. One of the core issues we really work with people on is building integrated data systems. So like a county or a state says, we want to pull together our cross-sector administrative data into a system, and not just a system that links it from a technical perspective, but a system that has a data governance process by which external parties can access the data, by which you can go through an ethical process of the state evaluating what types of projects and external parties should have access to the data. It's really important that agencies, as part of this process, are really thinking about what data they have, how sensitive it is, what the rules and policies are for using it, and to categorize the data they have by whether it should be open data. So there are some data that should be open, and if there's no reason, this is like, again, a very human-centered process of like considering the rules and policies, but also like considering all the stakeholder perspectives around like, are there data that can and should be open? And, or maybe not the data sets, but like dashboards or other public facing things where the public can interact with the data. Another thing to consider is if data should be restricted to certain access, which individual level data with population attributes should probably be restricted in most cases. And then there's some data that should not be used and viewable at all, maybe because they're really low quality and we don't want people to interact with those data, knowing that we're not painting an accurate picture or a high enough quality picture of what's going on. So there's a few issues entangled in here, but a lot of what we think about is how do you build a system, not just for pulling together your data, but also being able to make it more available and transparent and explaining to your community what you're doing with data and why. Thank you.
Thank you.